So today's World Diabetes Day, 14th November, coinciding with Children's Day in India, is an important day in the sense that the theme is educating people, educating healthcare workers, educating diabetes people living with diabetes and commoners as to how we can prevent diabetes and tackle diabetes once it is there. So it's extremely important that we stay informed. And for people with diabetes, it's a matter of concern, and it has to be through a multitude of interactions with their healthcare providers, that they know that what their disease is like, what they have to do to keep it under control as recommended by the various international bodies. And there are various, as Dr. Rafiq Masoodi sir was actually discussing in one of his questions, that there are various views on control of diabetes, for example, by various societies. So my advice would be that you stick to the doctor's advice. Don't try to doctor your therapeutic levels based on sketchy knowledge. You can ask a question, you have a right, I'm addressing the diabetes patients, you have a right to know what should be your HbA1c level, what should be the acceptable blood glucose level in the fasting or in the postprandial state. And after you do that, don't become Google doctors. Don't go to Google and look up whether Bashir Saab Lawi did say the right thing or he did not. Try to trust your doctor, because he is going to give an advice which is in the best interest of yours, looking at your individual person. It may not be necessary that what you learn from Google is applicable to you in your individual capacity. So there are various components that we have to take care of, be it diet, be it activity, be it taking care of your weight, taking care of stress. Those are all individualistic, and one of the young participants was asking whether she can take a medical career. Why not? We have Tom Hanks, we have Wasim Akrams. These are leading examples who have taken very, very exerting careers, and they've done well. And there are multiple examples of people with diabetes having done extremely well in their individual professions. And why should you not be able to do that? You can. Diabetes is controllable. Diabetes is something, someday, once you age, you always have one of the other diseases. Diabetes is a very difficult disease because it affects nearly every single organ system in the body. But it is also a blessing in the sense that you can control it. And once you can control it, keep it in that limited frame where you want it to be, then you can delay the complications as a result of diabetes. So that is extremely important, that you know your disease, you know what you need to do, and you need to know that this is something that I must avoid. Talking of awareness, I think in my personal capacity, the most important person who needs to be actually made aware and sensitized is the healthcare provider. I have seen that the worst of practices that are prevalent in our society are because of the poor sensitization of the healthcare workers. I'll talk about vaccination. Let me talk about vaccination. We did a study long back, maybe a decade back, about influenza vaccine. That is very famous now. Everybody takes a flu shot once when winter is approaching. So we looked at around 1,400 healthcare workers, which includes doctors, physicians, students, nurses, and other healthcare workers. We asked 1,400 people, do you think that there is a disease like influenza? They said yes. Do you think that is a potentially dangerous disease? Nearly 95% said yes. Do you know that there is a disease, there is a vaccine against influenza? 85% said yes. Have you taken an influenza vaccine? 4% had actually taken themselves. So if 4% of your doctors take a vaccine themselves, so obviously they're not going to prescribe it to the patients. That is where the education of the healthcare workers comes in. If your doctor does not, or your healthcare provider does not have a sufficient amount of knowledge and sensitization towards the prevention and treatment of diabetes, then obviously it will never translate down to the patients. And that is where it is very, very important. And also I was touched by one fact that Dr. Ashraf Ghanai talked about, is the corporate sector meddling into our prescriptions. And as doctors, there may not be a lot of evidence that one insulin is better than other. And we sometimes are forced by extraneous pressures to prescribe a drug which may not be necessarily more effective, but certainly is more costly. So that is something that I agree with Dr. Ashraf, that we need to keep in mind that this is a person with, there's a person like a Lakshmi Mittal, or there's a person who is outside a street vendor. So we need to tailor our medication according to the pocket of the patient. We need to know if we are giving an extra burden to the pocket of the patient, is he able to sustain it? A, B, is it worth it? Because that is that extra expense at a particular advantage, or it is not at an advantage? If it is not, we probably should deprecate that practice. Dr. Bashir Sahab, our dean, talked about the issue of diabetes educators. There are some issues, administrative and some legal issues in that, and I'm sure he is very well versed with that, and that's why probably this program, which was initiated way before I had actually joined this institute in my current capacity, has not taken off, and I hope that there is a solution to that, and we are able to get diabetes educators for the department. However, fellowships, we have already decided in the Dean's Committee that anything that any department wants to start a fellowship, be it in any section of the department, they can start it. Only thing is that institute will not pay for it. So all programs, I mean, there is some anomaly in that we start a program and we also in the same breath say that we are going to pay money for this program. It doesn't happen anywhere. I mean, all of you go for courses anywhere, be it any college, any university, you always end up paying some fee. So instead of, even if we don't pay a fee, but we should not be asking the university to pay something in terms of a stipend or some kind of a retainership. So that will not happen. However, beyond that, if you have the wherewithal, if you have the faculty, if you have the means, and you have the will to go ahead with any program, I assure you and I pledge support on behalf of the administration. In fact, you are the one who is actually to start it, because you are the dean, you are the custodian of the academics of this place. So I must once again congratulate the organizers for having conducted and organized this program for the people who best require it, and for the healthcare educators and the people who have diabetes or who need to know about diabetes. So we need to know how to prevent diabetes, what are the various lifestyle modifications that we can invoke so as to prevent a development of an impaired glucose tolerance test or an impaired glucose tolerance test going into a diabetes. So we need to understand it, recognize it, get those lifestyle modifications into our into our life, and God forbid somebody has a diabetes, he has to know how to live a normal life even when he has diabetes. It's possible. It's very, very much possible. Thank you so much.